Hi, I'm Dr. Raj Kirit. A very good day to you all. I practice in Celesti Skin Laser and Hair Clinic, which is located in Jubilee Hills. Today I'm going to talk about hair fall. Hair fall ranges from lots of age group, from age of 12 years to probably to extending until the age of 60 or 70 years as well. But what is important for us? Hair fall which is happening in youngsters or hair fall which is happening in the middle age group is one of the most concerning and discerning and as well distressing for the youngsters too. So what are the causes of hair fall? In generalized hair fall, it happens in males as well as in females. But in males, it is commonly termed as telogen effluvium or androgenetic alopecia, which is the male pattern baldness. Whereas in females, it is called as female pattern hair loss because most of the times the female pattern baldness as well as the telogen effluvium, the both chronic and acute, can coexist together, which is commonly seen. So that is why a very undefined entity which is called as female pattern hair loss is the commonest problem for hair loss. Coming to telogen effluvium. What is telogen effluvium? The hair, whenever a person is suffering with malaria, tuberculosis, or in conditions such as very emotional distress or physical stress, or any other conditions like dietic nutritional deficiencies, or even when the people are on dieting or crash diets. So these kind of things can trigger the condition called as telogen effluvium. The body is deprived of all the nutritional factors and hence it stops the hair and nails growth suddenly, and these hairs which become weak, they are shed off. This is telogen effluvium. But whereas the androgenetic alopecia is a genetic and androgen dependent, that is the reason it is termed as androgenetic alopecia. Whenever these baldness are affecting the youngsters, we have seen the earliest cases of grade 7 alopecia, that is the complete male pattern baldness in the age of 17 too. That is our experience. But we are seeing the male pattern baldness preponing as early as 12 years of age, and one case which has been reported at 8 years of age from Canada. So you see, baldness can be earlier onset. When it happens post like 30 years, post 40 years, it's all fine. But when it happens before the age of 30, that is more concerning for the young males as well as for the young females too. Coming to the types of alopecia, what is this grade 3, grade 4, grade 1? In case if any individual is losing around the forehead, that's called as grade 1, or grade 2, that's the earliest onset of male pattern baldness. If the person is losing at the front of the scalp as well as on the back of the scalp, that's called as grade 3 or grade 4. When the person is losing the entire strip of the baldness, the entire head, that's called as grade 7 alopecia. So males progress that way. So does baldness happen in females? Yes, it does happen in females too. Only thing is it goes unnoticed. There are two types of baldness. The male pattern baldness in female, when the baldness progresses from here, the front line hair, the hairline recedes back, that is called as the male pattern baldness in females. Whereas the other type of female pattern baldness, which is called the Ludwig's type as well as the Olsen's type, with the parting of the hair becomes more prominent. That is also a sign of female pattern baldness. So the parting becomes prominent, the thin head becomes prominent. Also you can see the scalp. Whenever you take a head bath and you come out and look into the mirror, you can see the scalp is very much visible, and also you see the thinning of the hair, and especially in females you can notice that the plates become thinner and thinner. Does thyroid cause hair loss? Yes, it causes hair loss. Thyroid problems persist and the hair loss can persist? Yes, thyroid problems can persist with hair loss problems. Why? Because the hair is always regulated with the hormones, especially with the thyroid and as well as with the testosterone. Now in females, there is a common condition called as polycystic ovarian syndrome or polycystic ovarian disease. Even the pre-PCOD patients who are more susceptible to PCOD, they can also present with more amount of hair fall. So the iron deficiency is one of the reasons, and also the PCOS also. So apart from the other causes such as stress as well as the iron deficiencies and other nutritional deficiencies, the hormonal conditions are also have to be looked upon. Once the females cross around 15 years, they are more prone to PCOS, especially when they cross beyond the age of 24. So every year checkup or an annual checkup of polycystic ovarian syndrome has to be done in case you are suffering with acne, hair fall, oiliness of glands, oiliness of the face, as well as for the weight gain and menstrual cycle irregularities. So these are the 5 conditions when you have to suspect that you might be suffering with polycystic ovarian syndrome. What is a balanced diet for hair? How much are we concerned balancing diet for your hair? The answer is very simple. You're supposed to take lots of fresh foods, fresh fruits, fresh vegetables, green salads, especially mutton liver and fish, and also prawns. Seafoods can contain more amount of biotin and minerals, as well as you can take lots of pomegranates, apples, and of course you are supposed to take soya bean chunks and a glass of milk every day. So this kind of balanced diet can improvise the hair fall, can improvise the condition, especially when you're tackling with hair loss. Coming to treatment of hair loss, the gold standard is minoxidil, either 2% in females or 5% in males, or even we go up to 10% in certain males where the amount of hair loss is extensive and we need to require the hair growth faster and better responses. So minoxidil is a gold standard which we can't replace. It's a time tested molecule. It helps in lots of patients, but only thing you have to understand, hair loss treatment is not temporary. It has to be long lasting. So the question comes, how long do we have to use minoxidil? You have to use it as long as you want hair. That's the only answer what I give to my patients. And the other treatments are mesotherapies, which we use platelet-rich plasma and dutasteride, as well as minoxidil, certain other medications where we use and we inject into the skin, and then the hairs start to grow up. But when do we see these results? In 3 to 6 months, we see them and we see persistent results, and we have very less failures. Coming to hair transplantation. Hair transplantation, we do both methods, FUE, the follicular unit extraction, which is the advanced, we use the advanced machines. We get excellent results with hair transplantation. FUE methods, you can hardly make out that there has been any scar or any hair transplant being done. The older technique, which is one of the good methods, that is called as follicular unit transplantation. I choose FUE in youngsters because it gives a lot of benefit for them because they have less scars. So these are the various forms of therapies for hair loss. First we have to stop the hair loss, and then we can go for the restoration of hair loss, and then we can do hair transplantations as well, depending on the condition and requirement. This is me, Dr. Raj Kirit. I practice at Celeste Skin Laser and Hair Clinic. I'm a consultant trichologist, dermatologist and hair transplant surgeon. I'm located in Jubilee Hills, Hyderabad. You can contact me in person for better information and for better treatment in my clinic, or you can contact through lybrate.com. Thank you.